All right, so we're gonna go over some of the questions that I prepared prior to my ICU interview in which I got the job. First question, what are your future career goals and how will this position help you achieve them? In this question, I talked about how I wanted to get my bachelor's in nursing since I right now have an associate's, and also going forward with a nurse practitioner in acute care for adult, and that the ICU was going to be the ticket in for those school programs for NP. Describe what great patient care means. The way that I worded this answer, I basically looked at the hospital's website that included some of their mission statements and the values that they have, and I incorporated maybe like the top 3 things that they talk about. And let's say it's compassion, integrity, community. So you want to create an answer that incorporates some of those key terms. Obviously, you have to believe it yourself that you are a compassionate nurse. Otherwise, why would you even be in nursing? Number 2, that you have integrity, and that you have a sense of community, that you care about your community. Describe a mistake that you made and what did you do to fix it. In this scenario, it's important that you show them that there was a mistake that you made, and not only leave it at that, but you want to show them that you created some sort of intervention in yourself, and then how you have now become a better nurse or a better person since that error that you made. So my example was, at my current job, we had a patient that needed blood work, and there was an error from my side that I didn't tell the oncoming shift about the labs, and it was basically labs that needed to be done right away. So because of the issue of communication from my end to the oncoming shift, those labs didn't get done as soon as they needed it to be done. It was brought up to my attention by nurse manager. So how I fixed that going forward is I looked at what other nurses were doing to organize themselves better throughout their day. A lot of them use report sheets. So I basically just gathered information from different nurses that I admired or that I knew had their shit together at work, and created my own flow sheet or nurse report sheet. And that made me be able to keep track of all the things. And that error never happened again. So basically I was able to identify a problem and plan an intervention, intervene, and then my evaluation is basically that I corrected the issue and it never happened again. What is the most valuable criticism that you've gotten from a manager? This is how I answered it. During clinicals, it was brought up to me by not a supervisor, but my instructor. They told me that you're trying to take on too much for yourself, that you are not able to complete all of your tasks because you have all these things that you're trying to get done, but it's impossible because it's just you. So the criticism that I got was, 1, that I take on too much, and number 2, that I never completed. So what I did from that was talk to my instructor again and said, well, what are some things that you recommend me doing? And one of the things that they recommended was delegating. This is where I wanted to show that interviewer that I can delegate to my support staff, that I don't have to do everything myself. Obviously, I'm going to supervise it, but I don't have to do everything. I can delegate it to my support staff, like my CNAs or PCTs. That was a way that they can see that I want to take care of everything and that I don't have a problem asking for help. So that shows them that you're someone that can be reliable and that isn't afraid to speak up if you're drowning in your own work. So one of the questions is, what are your weaknesses? So for me, this was a hard one because I didn't really want to show any weakness. You definitely want to come out as like a strong character that's, perfect for the job. But obviously no one's perfect and they don't expect you to be. So the weakness that I had was that sometimes I get too overwhelmed with new information or with a lot of information at the same time. And this ties into ICU a lot because you've seen ICU in your clinicals perhaps, and you know that these patients have like lines like crazy. They have a ton of different drips. There's tubes everywhere. there's just like an overwhelming amount of things that you have to take care of. So telling them that I become overwhelmed with things like that. However, not just leaving it at that, but how I approach that weakness is I basically dive in 100% into that subject that I don't know anything about. For example, arterial lines. I was able to look up a lot of information about them, how they work, why they're placed, what are the assessments for it, what to look out for. So it's just showing that you have the interest in learning things that you're overwhelmed with, not just like trying to run away from them, which as a student nurse, I may have done during clinicals. I'm like looking at something and I'm like, yeah, I'm gonna go see about doing something else that's way easier because I'm not even getting paid for this, right? I think we all have that mentality at some points because we're like overwhelmed. We're thinking about the next thing, like a next test, etc. Why do you want to work for this hospital? So in this scenario or this question, you want to go back to their mission statement or values. So the example that I gave was, luckily I was able to do clinicals at this place once for the OB rotation. And the nurse that I shadowed, this is all a true story by the way, had a patient that had a history of drug abuse. And this is a new mom. She had just given birth. I think the baby had some withdrawal symptoms. This nurse took care of this patient with integrity, number one. She showed true compassion. She didn't really judge this person by her history of use. And that shows, again, a sense of community because you don't care that your community, perhaps if you're like in a low income area hospital, there might be drug issues there, and you're just like basically there for your community. So I incorporated those three things. I said integrity, I said compassion because the nurse was compassionate, and that there was a sense of community, and that I really admired all those things from that nurse. And I would love to be part of a hospital that has those qualities because they align with me very well. And if you don't believe that for yourself, don't say it, but I do believe it for myself. Another question, how would you handle a rude doctor or supervisor? They're trying to see how you can try to tackle this one yourself before it gets escalated or it gets brought up to management. They kind of want to see how you can handle conflict. So for the rude doctor, you basically don't know what they're going through. I don't know what's going on with them. This isn't about me. Perhaps if, let's say, it is about me, you can talk to them. You can go right to them, and not in a confronting way, but more like in a make it about yourself. Is there something that I am doing that perhaps I'm doing wrong? Could this be a teaching opportunity? Is there something that you would like to talk to me so that I can perhaps not do something wrong? I'm a new graduate or whatever, I'm a student and you want to do things right. Basically approaching the situation where you ask them, is there something I can do for this situation to get better? If you notice, it's not pointing any fingers at that doctor who is being a total bag. Why are you a good candidate for this job? You can always apply the things that I already talked about, where you go to their website and look at their mission statement or their values. Or you can also add more things to this answer. I'm going to read this one out to you because I can't memorize it all. I said, I am ready to learn. That's number one. I am a very teachable person. My interest in this specialty, that I'm detail-oriented, that I'm responsible, that I'm efficient, that I'm culturally competent. You might not remember all these things when you're interviewing because your nerves are going to be through the roof. But if you can at least think of some of these when you're talking to this person. Professional attitude, and I love learning new things, especially ICU. I think ICU is fascinating. It's definitely like, I don't know if it's like my calling, but it's like what I really are interested in doing. I've worked as an LPN in a tremendous amount of different things like pediatrics, thoracic surgery, outpatient. I've worked at the VA in an outpatient clinic, hospice, and psych. That's been my latest job. And none of those really, like, I never really had like a thing for them. And That's why I am the best candidate for this, is because I'm fascinated. I'm basically like a huge ICU nerd. I want to learn it all. So if you can word your answer to involve why you're so passionate about that specific field, that you have the right attitude for a job so intricate and so detail oriented, I think that goes a long way. How do you deal with stress? So obviously ICU will be very stressful. You want to show them that you're not afraid of stress, that you have coping mechanisms to deal with stress. You may have seen this in your clinicals. You get to talk to some of the nurses, and sometimes the nurses party a lot. You don't want to be the nurse that parties a bunch so that you can like go drown out some feelings that you have about a case that, you know, maybe you're like, you haven't really been able to process. So the healthiest way that I could think of for dealing with stress is self-care. A lot of nurses talk about self-care like bubble baths and other stuff like that, but I'm not a bubble bath type of dude. So I say things like my interests. I have hobbies like that are like music or playing guitar. And there's no shame in saying even going to therapy. I think therapy, it's a great opportunity for you to just say everything that you're holding back, that you don't really have anyone else to talk to about, and process through these feelings. So that's how you deal with stress. Explain a time when you went above and beyond your responsibilities. This is going to be individualized. Everyone's going to have their own example. As a student nurse, perhaps there isn't a lot that you could have done in a clinical where you can go above and beyond. However, as a student nurse, you don't really have the patient load that you may have as a new graduate and you're actually working. And for me, it wasn't as a student nurse, but it was as an LPN. And basically we had a patient who called the clinic. He had just had thoracic surgery. And he called with some really worrisome symptoms. He was complaining of shortness of breath. He was pretty restless and pretty angry on the phone. I told him, hey, it seems like you need to go to the ER. I know you want to come to the clinic, but I don't think the clinic is equipped to like diagnose. Perhaps you need some imaging or some blood work. I would definitely advise you to go to the ER. This patient did not want to go, and then he hung up the phone. Anybody else, this is where I went above and beyond. I called this patient back and I said, I know you don't like me. I know this is hard for you to digest, but it seems like this is really worrisome. And I don't want you to go through anything that would be monumentally wrong with you. And if you could please, I know you don't want to, but I am asking you to please go to the emergency room. He hung up on me again. But eventually I called a third time and I spoke to the wife, who said he is on his way to the hospital right now. I ended up going to the ER at the hospital where he had surgery, which is where I worked, and ended up with a pulmonary embolism. This was like a big deal for me because I feel like if he hadn't talked to me and he had talked to someone else and just said, oh yeah, we can't get you in for an appointment to like, you know, check you out or whatever. What if he just stood home and didn't want to go at the end of the day and then died, you know? So I'm glad that he spoke to me and I'm glad that he ended up going to the ER. So this is an above and beyond scenario. Explain a time when you collaborated with others. You want to show that you are a team player. My example was I had a phlebotomist in the clinic who was swamped with work. I basically took it upon myself to clear out an area of the phlebotomy room and have people sit down, and I could like help that person do labs. Team player, right? That's the key one on that one. Describe a time when you needed to be innovative. We have patients that needed to come back to get their blood drawn for INRs, which is the test that you do when they're on Coumadin. And some of them were falling through the cracks because we were saying, all right, you need to come back in 2 weeks. And there wasn't a tracking system. It was like we were leaving it up to them to come back. Sometimes we would catch it and be like, oh man, this guy hasn't come back in 3 weeks. Who knows what his INR is now? So I created an Excel spreadsheet that was password protected for HIPAA. And basically in this spreadsheet, you could calculate, you could put a date for like the last time that they were here, you know, their name, the date, what their INR value was, just so you could keep track of it. and you put number of weeks recommended to come back. This was per doctor's orders, right? And let's say the doctor wanted him to come back in a week. You put 1 week and then it gives you the date, and it basically every day it calculates itself, and you can open it and it's refreshed, and you can see if they're late or something. And that's what we used. We had like 100% compliance with that thing, and it got to be such a good innovation in the clinic that 2 other clinics in my area started using it. Tell me about a time when you were challenged and you wanted to quit. They're looking for how you identified an issue where you were basically this close to quitting, but you didn't, and you pushed yourself through. And this is, I think, very important for ICU, because it's going to get hard. It's probably going to be terrifying at the beginning. But anyway, my example for this one was in school. In LPN school, I had an instructor that really, I guess she didn't like me, whatever. I was basically picked on a lot during class, and getting asked to like answer questions in front of the whole class, and sometimes I didn't know the answer, and I just got like panicked a lot of the times, because it's like you're being put on the spot, and I honestly sometimes wanted to like just leave and like never come back, or like I just was not motivated to be in that person's class, because I always felt like I was put in the spot and I didn't know my shit. The way that I overcame this was, next class, I prepared myself for that class before. I read everything in that chapter. I was basically like an expert already in whatever we're gonna cover in class that day. I came into class ready for, rapid fire from this instructor, and I knew my stuff. And I think that's how I overcame that fear, or that like wanting to quit moment for me. If you can show something where you had courage to push yourself through. Tell me a time when you stepped into a leadership role. We had a patient that wanted to leave against medical advice from this psych place that I worked. No one was helping her or listening to her. She basically waited for one of the doors to open and she bolted out. She luckily didn't run very far. She ran to the front door of the psych hospital or rehab place. But I opened the door and I had her in the lobby, just sitting there. We were talking and I heard her. I listened to her. I got down to her level. Basically, she was on the floor crying. She didn't want to sit on a chair. And I was just basically listening to whatever she needed. And she was like, I don't know what to do. I've been here a few times, relapsed from like drugs or alcohol. And I'm just asking for some help and no one's listening to me. And, she's in a vulnerable place. This is probably like her 4th attempt at trying to get sober. And staff is just kind of like fed up with this. And they don't listen to her if she needs something. She just wanted like a hot plate of food. And I'm like, you know what? I can make that happen. And I got her the freaking food. She basically that was it. That's all she wanted. She just wanted to be heard and not be treated like another, person that no one gives a shit about, which happens, unfortunately, sometimes if people keep relapsing and they're like, oh, here they go again. You know what I mean? So this is I think an example of a leadership role where I didn't just assume anything about this patient, and I stepped into a position of, I can help you. I can be a leader in this situation and solve this issue for you, instead of calling my manager and being like, hey, this patient wants this and that, can you take care of it? I took it upon myself and I helped this patient, and obviously I had to bring up the whole issue that she ran away, but I de-escalated the situation, and we got our patient back and we were able to help her that time. Tell me about a time when a patient's family was dissatisfied with the care, and how did you handle that situation? We had a patient's family that called saying that, hey, my son is asking for this medication and you guys aren't giving it to them. His anxiety is through the roof. What is going on? What are you guys doing there? If you have someone that is responding out of fear about a situation that's going on with their family members, it's usually because they don't understand what's going on. This is an opportunity to provide teaching. So the teaching that I provided to this mother of this kid that was in their facility was, oh, yes, your son wants this medication for anxiety. However, if I give it to him, his blood pressure is going to tank. His blood pressure is already too low, and it would be unsafe for me to give him that medication. I understand what you're saying, but this is a huge thing. We don't want to put your kid in an unsafe position. So we're trying to recommend other alternatives, which are other medications that don't affect the blood pressure, but this one does. It's not that we don't want to give him the medication, it's just that it wouldn't be the safest thing to do. And that was it. That's all she wanted to hear. She wanted to know that, hey, you don't have an idiot nurse taking care of my kid. You have someone that's actually like looking out for them. And this is an opportunity for teaching. Talk about a time when a patient was appreciative of your care. I had a patient that had sickle cell anemia and he was in crisis, and he had all these pain meds that weren't on his regimen while in the hospital because the admission was done by a resident who didn't have his whole health history. So I advocated for the patient by looking up his medical records on the computer and seeing what he is actually taking for pain and bringing it up to the nurse I was precepting with. And she basically called a doctor and we had new orders for his pain meds. So that's one way that you basically just go above and beyond. The next question, what are your thoughts on evidence-based practice? Basically anything that is a policy or a procedure in the hospital has to come from some sort of evidence-based source. Evidence-based practice is at the core of nursing, and you want to be an advocate for that stuff. You want to be able to say, if there's a policy in this place that doesn't have any evidence behind it, we need to try to find evidence for what we want to do in this protocol. You want to be able to advocate for the hospital, and I think that goes a long way so that you can show the hiring manager that you're all about expanding and furthering, is that a word? Expanding the care that you guys provide, all through evidence-based methods. What approach do you take when patients don't know medical jargon? So you want to be able to give an example of a scenario where perhaps another nurse or another healthcare provider was explaining something to a patient in bigger words than they understand. In my situation, we have a few nurses that just refer to as needed medications as PRN medications, and sometimes these people have never been in treatment, and it just increases their anxiety if they don't understand what the hell you're talking about. I just talked to the nurses and said, hey, can we just say as needed? I don't think he understands PRN. So it's just like a lot of anticipating anxiety in a patient and looking at ways that you can minimize that. And I think this would be one of them. You know, this isn't their usual. They're not used to being in a hospital, so why use medical terms that they're not going to understand? Give an example when you had to deal with a patient that was hostile. So in this situation, what I did was remove myself from the situation. There was a patient that had antisocial personality disorder. If you don't know what that is, look it up. It's not just being antisocial. It's more than that. Anyway, so this guy really was against society, whether it's like cops or you name it. And he thought that perhaps nurses have the same authority, or we are a position of authority. So he didn't like us and he didn't like me. And he basically just wanted to hurt me if I didn't do what he said. By being able to remove myself from the situation was de-escalated, and this guy was able to complete his treatment without triggers. And that is a huge thing with psych. You don't do any sort of power struggle where, like, if you have a hostile patient, you do not put up a front that is combative or aggressive or any of that stuff. You remove yourself from the situation. And if you've already taken NCLEX, when you've practiced or you've done some practice questions on psych patients, the answer is, if anyone is pissed at you and throwing things around, it's no longer using your therapeutic communication. It is removing yourself and removing other patients from harm's way. And you should know that. Describe a time when you had a patient who did not want to disclose information. How did you handle that situation? And what was the outcome? So for this patient, we had a guy that he had suicidal tendencies or suicidal ideation. He comes up to the window. He didn't really present himself as usual, which was friendly and charismatic. He was very flat, very withdrawn. So I just kept it open. This is another therapeutic communication skill that I think they're looking for in a question like this. I told him, hey, like, I am here we're here if you want to talk. We're here all night, so feel free to come back if there's anything that you want to share. Knowing that that was his history of like suicidal ideation and stuff, I just kept it at that. He did come back and talk to us, and it just helped him heal a little bit more. That's, I think, what they're looking for in this scenario. If you have someone that's withdrawn, suffering in silence, and they don't want to say anything, this is how you basically come across as like as a welcoming figure, and I think that goes a long way in places like the ICU. If you have family members that just cannot, for the life of them, figure out how they're going to deal with how sick their family member is, open it up for them to come talk to you. Bingo, you got it. You're now a therapeutic communicator. Describe a time when your facility was undergoing some change. How did that impact you, and how did you adapt? For this scenario, I talked about how we had a new director of nursing at my job, and there was a lot of pushback from the nursing staff because of this new figure of authority in our department. The DON, I want to say it's like really like by the book, really like authoritarian type of person, and was implementing a bunch of new rules, or rules that should have been in place from the get-go. A lot of the nurses had a lot of pushback for this. You know, it was like a new implementation to the unit, to the flow, to how the nurses behave or how the nurses do their job, and no one liked it, right? The pushback was unhealthy. Basically, it just didn't really create a good line of communication with the DON. Instead, I suggested, why don't we talk to her? And by her implementing policies, it doesn't mean that she's being mean to us. I think it just means that maybe our place needs a little bit more guidance, a little bit more clarity in the way that we do things. And there's nothing wrong with that. So understanding why she's doing the things that she's doing is really for the benefit of the whole facility. And sometimes you don't want change because it's uncomfortable and it's new, and maybe you're afraid of it. Embracing it would be way better. That's how you approach something new, something that is just been kind of thrown at you. Adapt and overcome it, and become part of the solution, and not just create pushback that is out of fear and out of like not wanting to change. Tell me about a time that you failed. How did you approach that situation? How did you overcome that? Failing is definitely something that no one wants to do. In this scenario, first started with how I failed, the steps that I took to recover from that, and where I am now. So that's what you want to show. For my scenario, I said, I was in paramedic school. I went to paramedic school years ago, and I wasn't sure if that's what I wanted to do. And towards the 3rd out of 4 semesters of paramedic school, I quit. I basically failed out of the classes. I felt terribly because I didn't really know what I was going to do with my life, but I think it was what I needed, because finishing paramedic school and becoming a paramedic may have not been my calling, to call it something. So I needed to quit, deal with that failure, and deal with like the negative feelings that came from that, so that I could find what I really wanted to do. And that was nursing. That was definitely nursing. I went back to school to become an LPN, and then I got my RN after that. Again, it's something where you failed. You couldn't really like muscle through it, but no one says that you should. So don't feel like, oh, I failed out of something, and feel terrible about it, because it might just not be what you're cut out to do. And that's okay. Maybe there's something else that you're supposed to be doing. Maybe it's not even healthcare, you know? Maybe you think that ICU is like the place for you, but what if it isn't? What if it isn't for me? I don't know. Next question. Talk about a time you worked in a fast-paced setting, and how do you prioritize tasks while maintaining excellent patient care? So you could talk about clinicals. I definitely did talk about clinicals, because this is where the experience I had with like dealing with like a lot of different complicated situations all at once. You want to say that you want to stick to basics. Remember those like NCLEX questions that they give you 4 patients to prioritize, and one is sicker than the next one, and the other one's sicker than the other one, but one is sickest of them all, and you basically are prioritizing your care. So you can apply that same concept to the floor, to like your actual unit where you're going to be interviewing for. Stick to ABCs, learn or feel comfortable delegating, just being able to like voice your concerns, reach out for help. And that's how you do it. You do it as a team. And I think they really like those answers, because you're not just like carrying all this weight and acting like a superhero. You don't want to come across like that, because it just shows that you're not really willing to be a team player, that you'd rather do things yourself instead of reaching out for help. And then if a mistake happens, you would rather keep it to yourself instead of actually asking for help to get it fixed. And then that could mean patient's health is at risk. Ask questions about the unit. They're going to ask you, do you have any questions for us? And you've probably seen other YouTube videos where everyone says, no, you don't want to just say, no, I don't have any questions, because it makes it look stupid, right? But I asked from the experience that I had reading or watching all these other YouTube videos that recommended what to do. Ask, what does the orientation or the new hire preceptorship look like? What are the expectations of new grads in the ICU? How am I going to feel that I'm supported? Will I have some sort of guidance from you, specifically the hiring manager, or is there someone that will basically look out for us as new grads in this, really scary new place that is the ICU? You want to show that you're interested in working there, but you also want to go into a place that looks out for their employees, and that gives you a good idea if that's a good fit for you. Because sure, you can say, oh yeah, I love the ICU, I'm just going to go wherever they want to hire me. Well, be careful with a decision like that, because you don't know what their orientation looks like. Maybe they have you just shadow for a few shifts and then you're on your own. And then other places will be more conservative with that, and they'll actually have a whole training program that takes months. You want to be able to ask those questions for your own benefit. Okay, so those are the examples that I have. I hope this was beneficial to you. I'll list the whole set of questions in the description below, so that you guys can see or refer back to my answers. Hopefully you guys can just tailor the same stuff that I said, but apply it to your own experiences. If you have any suggestions, please let me know, and good luck out there.